Today's topic provides an inside look at the challenges and solutions to providing patient specific education resources. In this session, we will highlight the MedlinePlus Connect tool and its use in two provider practices. I'm Connie Gillison, and I'll be your host today. Now I'd like to welcome our presenters. Leading the discussion today will be Robert Furberg from RTI International, Stephanie Dennis from the National Library of Medicine, Dr. Ruth Lesniewski with the Institute of Family Health, and finally, Dr. Michael Tote, the Clinical Director at the Cherokee Hospital System. Without further ado, I'm going to turn it over to Robert.
Great. Thanks, Connie. Good afternoon, everybody. So good afternoon and welcome, everyone. I'd like to start out by acknowledging my appreciation for each of you taking the time out of your day to join today's session, and I hope that you find it useful. My name is Robert Furberg, and I'm a senior clinical informaticist at RTI. For the past 3 years or so, our project team has been working with the ONC as a member of the HITRIC, supporting regional extension centers and eligible providers in their efforts to achieve the meaningful use objectives that address patient and family engagement. One of the ways in which we do this is by delivering presentations like this one today, which we strive to make as informative and applied as possible. And I'm hopeful that you'll find today's session on the provision of patient-specific education resources beneficial. We're going to do this by addressing some of the challenges that are associated with achieving this particular objective by featuring specific individuals who are expert in the development and implementation of solutions to do so, as Connie mentioned, namely the National Library of Medicine's MedlinePlus Connect resource. I'm joined by 3 other panelists who will each speak to their own area of expertise. From the National Library of Medicine, Stephanie Dennis is going to provide an overview and a demonstration of the tool. Dr. Lesniewski is going to talk about their experience with the implementation of MedlinePlus Connect from the perspective of a primary care provider with an eye toward the unique challenges associated with the provision of urban health and health disparities. And finally, Dr. Tote, as mentioned from the Cherokee Indian Hospital System, is going to discuss his experience with implementation as a primary care provider from the rural health perspective. Through the course of the session, kind of at the end of all of this, we really hope that we achieve the following things. 1, to remind you of the importance of providing patient-specific education. 2, to increase your awareness of the MedlinePlus Connect tool, which we think is a fabulous resource. 3, to share relevant experiences from different types of practices. And 4, ultimately to identify and discuss the leading practices for achieving this objective. So I think, to kind of start things out, we feel as though providing educational materials to patients is important because it can do the following things. It can improve an individual's knowledge and understanding of screening, diagnosis, or treatment plans for specific medical conditions. It can help patients and caregivers remember important information between visits. It can enhance self-efficacy and an individual's ability to manage their own health. It can increase participation between patients and clinicians to enable more informed decision-making about an individual's own health and management of their conditions, which we think is one of the most salient points. Some examples of patient education resources are informational materials about specific health conditions, medical procedures, screening and diagnostic tests, medications, and specific clinical interventions. Patient instructions are also patient education material. Instructions that explain what patients need to do, including self-care instructions, medication instructions, dosing regimens, when to come in for follow-up appointments, tests, and procedures, when it's appropriate to call the provider. Self-management tools are also included. Such resources help patients manage their health conditions, including instructions on tracking blood sugar levels and asthma symptoms, daily blood pressure checks, and the like. And finally, the next sort of major category that we've identified are clinical decision support tools. These are resources that help patients better understand the scientific evidence, as well as the potential risks and benefits of different healthcare choices, ultimately enabling them to make more informed decisions based on the evidence and their personal values and preferences. We hope that these are the kinds of resources that providers are using to improve communication with patients, family members, and their caregivers. Taking a look at the specific objective from the Meaningful Use Rule, you can see the objective and measure listed on the slide here. I think it's important to note that although certified electronic health record technology must be used to identify patient-specific education resources, those resources or materials do not have to be stored within or generated by CEHRT, right? The eligible provider in these instances should really be using their EHR systems in a manner where that technology is used to suggest the patient-specific education resources that are appropriate for dissemination by using the data from within their EHR. Then it's incumbent on the eligible provider to determine the appropriate format and means for sharing that patient education by either providing an electronic copy, a printed copy, or an electronic link to source materials through a patient portal or pushing out to a PHR. There are a variety of electronic resources available to support this type of dissemination of patient education materials, and today we're really going to hear more about one specific resource that caught our attention for its accessibility, credibility, and availability. And with that, I'd like to turn things over to Stephanie Dennis from the National Library of Medicine.
Thank you so much. Well, hi, everyone. This is Stephanie Dennis, and as you heard, I'm with the National Library of Medicine. I'm with the Health Information Products Unit, and that is the team that manages MedlinePlus and MedlinePlus Connect. And I should add that the National Library of Medicine is part of the National Institutes of Health. So I'll be talking about MedlinePlus Connect, which is a service the National Library of Medicine offers to help deliver patient-specific education resources to patient portals, EHRs, and other health IT systems. And the source of this content is MedlinePlus.gov, and that's a website also run by the National Library of Medicine, and it contains easy-to-understand and reliable consumer health information. So let me first tell you a bit more about MedlinePlus.gov and why it's a great resource for this patient health information. It contains current information that's all written at a consumer level. The whole site is really designed for use by patients and their families. And it brings together content from organizations like the National Institutes of Health and the Centers for Disease Control and Prevention, and other trusted organizations. And all of those organizations and all the content on MedlinePlus has been vetted by the MedlinePlus staff, and we have very strict quality guidelines. There's absolutely no advertising, and it's available in both English and Spanish. Plus, we also offer information, consumer health information, in over 40 other languages. So MedlinePlus Connect is a resource that brings this great content from MedlinePlus to patients and others in electronic health records or a health IT system. So it's bringing it to them at the point they need it. And as you know, this ties in directly with that meaningful use, the meaningful use goal that we just heard about, the patient-specific education resources. This is a quick overview of how MedlinePlus Connect works. First, the EHR or PHR will send MedlinePlus Connect a specific problem or diagnosis code, medication code, or lab test code, which it wants related consumer content for. Then MedlinePlus Connect identifies the related content from MedlinePlus for that particular code and returns a response. The EHR or the PHR can then use that response to serve up the information to the users in a patient portal or also in the clinical-facing system. So I mentioned that MedlinePlus Connect can receive a code-based request, and here are the code systems that MedlinePlus Connect can respond to. For the diagnoses, we'll accept ICD-9-CM and SNOMED CT codes, and we will be able to accept ICD-10-CM codes in the future. For medications, we'll accept RX-CUIs and NDCs, and for the lab tests, we accept LINC codes. MedlinePlus Connect is designed to enhance an existing health IT system. So this is not a standalone tool, but again, something which will enhance the existing system. It can be implemented by EHR vendors and health IT companies who can then make it available to their users. And in some cases, the health IT purchasers may be able to implement it directly, but that depends on their administrative rights in the system. We do follow the HL7 Context-Aware Knowledge Retrieval Standard, also known as the Info Button Standard, and we can provide a response in either English or Spanish. It's free to implement, and we don't require any registration or licensing to use it. MedlinePlus Connect is available as both a web application and a web service. The web application will deliver an on-demand formatted MedlinePlus Connect response page, and from there, users can link through to full pages of content on MedlinePlus. We also have the REST-based web service, and that returns information in XML, which then allows the health IT system to customize how they want to present that information to their user. And I'm actually going to show you examples of both, so we'll see both in action. First, we're going to take a quick look at the web application. And we're going to walk through each of these steps, so you'll be able to see them a little bigger. Here's a fictitious patient, Jane Smith, and she is looking at her view in her patient portal. And she's looking at her conditions. And let's say she wants more information on asthma, which is something she's been diagnosed with. Once she clicks on that, she'll be taken to the MedlinePlus Connect web application response page, and that includes links to the full pages of content on MedlinePlus that relate to that specific condition, in this case, asthma. She can also read a brief summary of the condition and go to other links on specific content that she might find most helpful. When she clicks through to the full MedlinePlus page on asthma, from there she can navigate to the content that she'll find most meaningful to her. This is a look at the table of contents on that asthma page, and hopefully it gives you a feel for the variety of content that MedlinePlus contains. There is general overview information, prevention information, treatment information, and also demographic-specific information. For example, you'll see here links to information on children, women, and seniors. And here are some examples of items under the Overviews and Latest News categories. And I mentioned that it's available in both English and Spanish, but once you are on a topic page on MedlinePlus, there are links to content in languages other than English or Spanish. And in this case, these are the languages for which we have information available about asthma. Now we're going to look at the sample web service response. So here we're starting with the wireframe view of a patient portal. So again, imagine our patient Jane is looking at her portal. And you can see here they've actually embedded links and some of the summary explaining asthma directly into the portal. So it's up to the EHR which pieces of information or links they want to include and how they present that information to the user. From here, again, the user can click through to the full asthma page on MedlinePlus, or also go to specific pages of information that might be most helpful. MedlinePlus Connect has been available since November of 2010, so it's still fairly new, but we've been really pleased with the use. And here are some of the health organizations who are using it. This is not a comprehensive list. As I mentioned, we don't require registration or licensing, so we actually don't have a full list of everyone who's using it. And we'd actually be really interested in hearing from you if you're aware of others using it, particularly small practices who are making use of MedlinePlus Connect. And here are a list of some of the EHR systems that are making it available to the users. The Institute for Family Health, who we'll be hearing from soon, will be talking about their implementation with Epic MyChart, which is, of course, one of the items listed here. And we'll also be hearing about RPMS and their implementation with the Indian Health Service. And with that, I will turn this over to Dr. Ruth Lesniewski at the Institute for Family Health.
Hi there, I'm Ruth Lesniewski. I'm a family physician with the Institute for Family Health, and I'm going to talk to you about our experience with MedlinePlus Connect. Just to give you a little background, we are a network of FQHCs and residency programs and other programs in New York City and the Hudson River Valley. So all in New York State, some very urban and some rural or semi-rural sites. We implemented Epic in 2002, and the patient portal, which we call MyChart My Health, a few years after that. Before we implemented the portal, and we did some focus groups because we were a little concerned about how our patients would respond to the idea of a patient portal. And what we found was that our patients were concerned about their ability to understand medical information. But contrary to our expectations, they weren't all that concerned about privacy and confidentiality. What patients were worried about in particular was that test results would be released without any explanation, that they would see information in the record that they wouldn't be able to understand. And we also learned that many of our patients already used the Internet for health information, but they felt overwhelmed by the volume of information available. So when they searched a condition that they had or that a family member had, there were too many options, too many things that appeared, and they didn't know how to sort through those options to find reliable information. One example of this is that people in the classes didn't understand the difference between .com, .gov, .org. So even that basic way to distinguish websites from each other was something completely new to most of the participants. We also did a survey of our patients in English and in Spanish, and we found that the majority use the Internet, but the main reason for the 25% or so who don't use the Internet is that they don't have a computer at home. One thing we didn't assess in this, but that we learned later, is that a lot of our patients who do use the Internet have access to it only via smartphone, not via a laptop or desktop. So as I said earlier, our patients need explanation for the basic information in their health record. This is true for lab results, like what you see here, and it's also true for medications. So when they go to the health record and see a list of medications, they may find that information confusing. We chose MedlinePlus to help our patients understand the information in their health record, partly because it's free. That's definitely a big advantage. Also because it's frequently updated, and because it's written at a simple, low literacy level in multiple languages. The direct linkages between the health record and MedlinePlus in the MedlinePlus Connect system, that was a really important feature to us. So the slide here shows what would happen if you went to the website and searched metformin. You'd come up with lots of information, many terms with multiple syllables, very long names, and it could be difficult for someone with low literacy, maybe someone who's not a native speaker of English, to sort of sort through this and go directly to what they need. So this page shows linkages by problem. So this is what the problem list looks like in our portal. The problem list gets translated into simpler terms, but even those simple terms may be difficult for our patients to understand. So as Stephanie showed you earlier, a patient can click on a particular problem on the problem list, in this case, hypertension. And after that click, the patient goes directly to the MedlinePlus Connect page for that problem. The link is seamless to our patients. So it doesn't bring you to a search page, it brings you to the correct page for that diagnosis. And to a patient using the system, it really feels like the same website rather than two separate sites. It may not be completely clear to our patients that they've moved from one website to another because the linkage is so smooth. The linkages work in Spanish too. So this is the My Chart page in Spanish, and then the linkage to MedlinePlus Connect also in Spanish. So this chart shows the most common searches that our patients have made in using MedlinePlus Connect. This group of conditions really just reflects the frequency of those conditions among our patients. So what it shows is that most people are searching the conditions that are on their problem list. This rather busy graph here compares the demographics for portal users and non-users. That's on the right, and then also for MedlinePlus Connect users and non-users, and that's the two columns on the left. There weren't a whole lot of differences among those groups, but I would say that MedlinePlus Connect users tend to be slightly younger and slightly more non-white than the MedlinePlus Connect non-users. This page is a continuation of that same analysis, and this gets at some of the insurance status info, which we use as a proxy for socioeconomic status. So what you see here is that MedlinePlus Connect users are more likely to have Medicaid insurance than the MedlinePlus Connect non-users, which for us is a proxy for lower socioeconomic status. So this is interesting to us that our patients with lower socioeconomic status are more likely to be using MedlinePlus Connect. And then this slide shows health conditions, and the differences again here were pretty small, but in general, the MedlinePlus Connect users have more chronic health problems than the MedlinePlus Connect non-users. Then going back to the patient portal classes, we found that when patients saw the MedlinePlus website, they were so excited about the quality and usability of the information there that they started looking up their own health information and their family members' health information rather than following along with the class. So, our patients overall have had a really great response to MedlinePlus. And that's it. Thank you very much.
I'm Dr. Michael Tote. I'm also a family physician, and I'm the clinical director at Cherokee Indian Hospital. Cherokee Indian Hospital serves the eastern band of Cherokee Indians in western North Carolina. We're about 3 hours west of Charlotte, about 3 hours north of Atlanta, and tucked away in the mountains where we have a lot of patients living in rural setting, growing number of patients with internet connections, but still not great penetration for smartphones and that sort of thing. We don't have 4G out here yet. The discussion that I'm going to talk to you about today is the use of the MedlinePlus Connect integrated with the Indian Health Service electronic medical record. The name of that electronic medical record is the RPMS EHR, and I'm sorry about the initials, but that's its name. It stands for the Resource Patient Management System, and that's RPMS EHR. This is a view of what our electronic medical record looks like, and you can see down on the mid panel where there's a red circle, the lower of the, or oval rather, the lower red oval highlights an I button next to the diagnoses. So you can, this is a demo patient, but I have highlighted in blue the tobacco abuse diagnosis. You can also highlight a diagnosis from the problem list. We also have the I button linked in with the medication list and linked in with lab code. So this would apply in any of those situations, but I'll show you how it links with diagnosis. So if I were to click that lower I button with tobacco abuse highlighted, it automatically then, because the diagnosis has already been coded in the computer with an ICD-9 code, it seamlessly goes to MedlinePlus Connect and pulls up health information on smoking. And there's a link which says more on smoking on the left lower portion of the page, and if you click on that to get further information, then it goes into the main MedlinePlus and gives you further information, as we said, available in different languages. They do have it available in Navajo, and many of the Indian Health Service serve Navajo communities. They don't have Cherokee yet, but we have unfortunately not a lot of native speakers left, and even of those native speakers, many of them don't read in Cherokee, but most of them are English speakers, at least English as a second language. So we are able to get this information, and then if you go further down and click more information, it might link to another website such as the National Institute on Drug Abuse with drug facts about cigarettes or other tobacco products. And depending on the diagnosis and where the source of information is, you can get further along as detailed as you want, but it usually starts out general and then goes more specific. And so you can tailor it to the patient's needs. We do this real time with the patient, sitting with our laptop computer in the room and pull the information up. That way they can see that it's available on the internet if they have internet access, but because most don't, we go ahead and print out the pertinent information that we want to hand to them, and we begin to discuss it with them. If you just hand a paper without ever going into it, they're less likely, we feel less likely to ever break it open, but if you start to show a little bit of what's on the pages and what's in it, it just makes them more engaged for after they leave the exam room. One of the really nice features about integrating this with our electronic medical record is that when we then close the web page, it automatically documents that we did the patient education using literature. So you see this box that comes up, and it has the education topic. The 305.1 is tobacco use disorder. And it shows that we used literature and that we did individual training. You can put the comprehension level, the amount of time you used it, put any comments in. You can enter their readiness to learn, whether or not a goal was set or met or not met, and enter in free text about the goal. You can also enter in any learning health factors, such as either barriers to learning, what their learning preference is, how they like to receive information, and if they don't want to have any information, you can even enter in a refusal at that point. And that's really to prompt you to try again at another time. It's not to give up. The next slide shows how that education will look in the chart after it's been entered. Once that box closes down, we do have an education tab, so we can look on future visits, we can look back to this visit to see what education's already been provided, what the goals were, if there were any comments on it. I have highlight hypertension and tobacco use on this patient where that's been documented. One of the most important things is figuring out how to work this into your workflow. And I will say that each practice has to decide how they want to do it and what works for them. For us, it works very well that anyone who's seeing a patient can use this. So a nutritionist can use it, a pharmacist can use it, a physician, physician's assistant, nurse, they can all use the same system. It'll still record who did the education, so that's all very appropriate. But we're all committed that this is a team effort and that it's not just falling on one person to have to do education. We each take it as an important part of our team approach. You want to look at certainly making sure that the patients have a little bit of insight into what it is that you're going to show to them, and that helps to deliver that value. With time and convenience issues, if you automate this process, we do this with every visit. That way we're less likely to forget it. Even if it's just, if they're not ready to learn yet because they may be in a different stage, we go ahead and at least open up the conversation by providing them with a handout. Then with the need for resources in other languages, we mentioned that you want to select a source that offers resources in multiple languages. With over 40 languages with MedlinePlus Connect, it's really just fantastic, and we're looking forward to seeing more languages added on, but it's already meeting our needs. And then remember that patients' information preferences and needs may vary. Some may prefer to have a link. Some may prefer to use, with the first presenter, as she showed how you can do that through a portal, or they may want it at the point of care to directly ask questions with someone right there face-to-face, so it can be done in the office. I'll certainly offer that if anybody would like to have more information about how it's integrated with RPMS, we can share that, but I don't have information about how it's integrated into other records. I'll have to defer to some of the experts who may be on the line from National Library of Medicine, but I'm really enthusiastic about this tool. Patients really get engaged with it. Staff likes it, makes things a lot easier. And then when you integrate it with your record where it's automatically doing that documentation and helping you meet meaningful use documentation requirements, that's an added benefit. And thank you very much, and I'm going to pass the ball on over back to Connie.
We have a link to some really nice resources on patient-specific education, and there's a fact sheet on here that really highlights some of the things we talked about in today's presentation. And if you would like to learn more information, you can contact Catherine Treeman and also Stephanie Dennis, and they'll definitely be able to assist you. Thank you all for participating today. We hope that you enjoyed the session. Please email the HITRIC training team if you have any questions. Thanks again for joining. We look forward to seeing you on future webinars.